Welcome all. Welcome to Is Pharmacology Difficult? I'm Dr. Radhika Vijay and today we are going to study some definitions in pharmacology. So let's get started. Now pharmacology is the science of drugs. Now what do I mean by saying that? In Greek, the word pharmakon means a drug and logos means discourse in. That is, logos means a study of. Now, the historical briefs we are going to summarize that thousands of years back, there were only crude natural products of unknown composition and limited efficacy, and only overt effects of these substances were imprecisely known. Animal experiments primarily aimed at understanding physiological processes. They were started in the 18th century. And the pioneers for doing all these things were Francois, Magendie, and Claude Bernard. They adapted to study the effects of certain drugs. Do you know Rudolf Buchem? He found the first institute of pharmacology in the basement of his own house in 1847 in Germany. So he started and pioneered with experimental science. In the later part of 19th century, Oswald Schimmelberg, he regarded as the father of pharmacology. Yes, Oswald Schimmelberg is the father of pharmacology. So let's derive a sort of a definition for this wonderful subject, pharmacology. In pharmacology, we study as to how drugs can alter the physiological or biochemical functions of a living organism. So, pharmacology can also be defined as a science which deals with the mechanism of action, therapeutic uses, adverse effects, and fate of drugs in human beings or animals. Now, this is the definition of pharmacology. Now comes the next important term that is most commonly used in pharmacology, and that is drug. Let's come to the derivation of this particular term, drug. So in French, drogue, it means a dry herb. So that is how this drug term has its derivation. Now let's get an idea of the basic concept of the drug. It's a single active chemical entity present in a medicine and it is used for diagnosis, prevention, treatment or cure of a disease. So this is the basic concept of this particular term that is known as drug. Now when you talk to a layman and ask him what is a drug, he will definitely misinterpret it and use it for some sort of addictive, abuse, illicit substance. Now this is a restricted and derogatory sense usage. It is very unfortunate degradation of such a time-honored term called drug. So, what should be the right approach? The drug should refer to a substance that has some health promoting, some therapeutic, some diagnostic application, and to avoid some sort of misinterpretation, medicine is employed to designate a substance in place of the term drug. Now this is one of the interpretations. Now I'm going to make some of the corrections also. The definition or the concept that I just recently discussed for this term drug is incomplete because it ignores the use of contraceptives because they alter the physiological system to prevent pregnancy, and pregnancy is not a disease. On the same analogy, the definition also fails to recognize general anesthetics as drugs because they are not used for any cure, they are not used for any diagnosis or prevention of a disease. And on the same stream, vaccines and antisera, which alter the pathological state by formation of antibodies, are also not appropriately to the skin covered by this concept or early definition. So finally, WHO, World Health Organization, has given a very comprehensive definition of drug, and that will be our final definition. Drug is any substance or product that is used or intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient, that is the patient. Now, this definition covers contraceptives, it covers general anesthetics, it covers vaccines, it covers antisera, and all the various types of substances that are affecting the body or the physiological system or the pathological state in some way or the other. So, that is our final definition of a drug. Now, let us have a look at the subdivisions of pharmacology. The two main subdivisions or the two main branches of pharmacology are pharmacokinetics and pharmacodynamics. Let's get to know about them one by one. The first one is the pharmacokinetics. Now, how do we derive this particular term, pharmacokinetics? In Greek, kinesis means movement. So, what does we get an idea from this particular branch? It tells us what the body does to the drug. It includes absorption, distribution, metabolism, and excretion of drugs. In short, we can abbreviate it as ADME studies, ADME studies. Now, it refers to the movement of drug in an alteration of the drug by the body. I'll give you a very good example. Paracetamol is rapidly and almost completely absorbed orally. It attains a peak blood level in 30 to 60 minutes. It is 25% bound to plasma proteins. It is widely and uniformly distributed in the body. The volume of distribution is 1 liter per kg. It is extensively metabolized in liver, primarily by glucuronide and sulfate conjugation, and forms inactive metabolites. Now, these are excreted in urine and have a plasma half-life, that is T half, of 2 to 3 hours, and the clearance value is 5 milliliter per kg per minute. Now, why am I telling you all about paracetamol so much in depth? Because this is, in summary, the whole pharmacokinetics of paracetamol. It includes the absorption details, distribution details, metabolism details, and excretion details. So that's how we sum up the pharmacokinetics of a particular drug. This was paracetamol pharmacokinetics in short. Now, the next most important branch we ought to know about is pharmacodynamics. How do we derive the term pharmacodynamics? In Greek, dynamic means power. That is, it tells us what the drug does to the body. The last one was what the body does to the drug. So they are inverse of each other. It includes the study of biological effects produced by the drugs, the site at which the drug acts, and the mechanism by which the drug acts. It also tells about the relationship of plasma concentration of the drug with its response and duration of action. It includes the physiological and biochemical effects of drugs and mechanism of action at organ system or subcellular or macromolecular level. This will be clear with a very good example of adrenaline. It interacts with the adrenoceptors. Then there occurs G protein mediated stimulation of cell membrane bound adenylyl cyclase, which leads to increased intracellular cyclic 3-5 AMP, which further leads to cardiac stimulation, hepatic glycogenolysis, and hyperglycemia. What was this whole story of adrenaline? This was the pharmacodynamics of a drug called adrenaline. So that is how we sum up the pharmacodynamic and all the details of a particular drug. I hope this concept is now crystal clear in your mind. Now, the next important subdivision, though not as important as pharmacokinetics or dynamics, but yes, important, is pharmacotherapeutics. What is it? It is the clinical application of pharmacokinetic and dynamic information about the drug, and it helps in the prevention, treatment, or diagnosis of a disease. So, it is the application of all the information together with the knowledge of the disease for final mitigation or cure of the disease. In this, we select the most appropriate drug, the dosage, the duration of treatment, all are taken into account along with the stage of the disease. The specific features of patient are also a part of this particular branch known as pharmacotherapeutics. Now, the next important branch is clinical pharmacology. It is a scientific study of drugs, both old and new in man. It includes the pharmacodynamic and kinetic investigations in healthy volunteers as well as patients, evaluation of efficacy and safety of drugs, and comparative trials with other forms of treatment, surveillance of drug use pattern, and adverse effects, etc., all are part of this particular branch. Now, the aim of clinical pharmacology is to generate data for optimum use of drugs and to practice evidence based medicine. It also includes the feedback monitoring of adverse effects of a drug after the drug is marketed. So, there are so many aspects included in this one particular branch called clinical pharmacology. Now, the next important subdivision or branch of pharmacology is toxicology. It deals with the study of toxicity and poisonous effects of drugs and various chemicals in use. We can use them anywhere: household, environmental, pollutants, industrial, agricultural, or homicidal. Any use. And it also includes emphasis on symptoms, detection, prevention, and treatment of the poisoning. It also includes the study of adverse effects of drugs, since the same substance can be a drug or a poison, and it all depends on the dose. Harm is the end point in toxicology, and benefit is the end point in pharmacotherapeutics. Now, this is a beautiful quotation that describes the importance of a dose of a particular substance. Now, the next important and very good subdivision of pharmacology is chemotherapy. It is the treatment of systemic infection or malignancy with specific drugs that have selective toxicity for the infecting organism or the malignant cell, and you know what? They cause no or minimal effect on the host cell. That is the most important mechanism of this particular branch. There is no or minimal effect on the host cell. The drugs can be either pharmacodynamic agents or they can be chemotherapeutic agents. Pharmacodynamic agents are designed to have pharmacodynamic effects in the recipient or the patient, and chemotherapeutic agents, they are designed to inhibit or kill the invading parasite or malignant cell. But again, I repeat, they have no or minimal pharmacodynamic effect in the recipient or the patient. Now comes a very day-to-day in use and what we all see in our practicals, the subdivision of pharmacology, and that is known as pharmacy. What is pharmacy? It is the art and science of compounding and dispensing drugs, or it is also the preparing of suitable dosage forms for administration of drugs, and this administration of drugs can be to man or animals. It also includes the collection, identification, purification, isolation, standardization, and quality control of medicinal substances. And do you know one very similar term is pharmaceutics, but it is very different from pharmacy because it is a technological science and it involves large-scale manufacture of drugs. Now, pharmacy also differs from pharmacology as pharmacy is more of a profession, and with the rapid advancement of dosage forms of drugs, the pharmacist now is no longer required to prepare and dispense the drug. It is done by the pharmaceutical manufacturers. So with the changing era, with the changing times, the role of pharmacy expert is of the community and hospital pharmacist. They have more specific knowledge about other properties of drugs like their stability, shelf life, preservation, handling of the drug preparations, and helping the patients in proper use of the drug. All these aspects are covered in pharmacy. Now comes a very interesting branch or subdivision of pharmacology, and that is pharmacogenetics. It is a study of inherited, that is single gene mediated, differences in drug metabolism or drug response in humans. I'll give you a very good example. For example, peripheral neuritis, it occurs in slow acetylators, and hepatotoxicity occurs in fast acetylators of isoniazid. And isoniazid, I'm sure you all might be knowing, is an anti-tubercular drug. Now, the next important and interesting subdivision of pharmacology is pharmacoepidemiology. It is a study of use and effects of a drug in large population after its approval for clinical use. It is well established nowadays that the risk-benefit ratio of the drug, it can be ascertained only after the drug is used widely by the general population. So that forms the basis of this particular branch of pharmacology. Now, the next important subdivision or branch of pharmacology is pharmacogenomics. It is not pharmacogenetics. It has an overlapping with the pharmacogenetics, but its name is pharmacogenomics. It makes the use of genetic makeup or genome of an individual to choose a particular drug therapy for the responders only. And there is avoiding of giving drug to the non-responders. So, what is the summary? The tailoring of the drug therapy is done on the basis of an individual's genotype. This will be clear with a very good example. A recently introduced anti-cancer drug, gefitinib, is highly effective in curing lung cancer, but only in those patients who have mutations in the tyrosine kinase receptor. That is, it is only 10% of the cases. So this is the target of the action of this particular drug, gefitinib. Such individuals, they can be identified in advance by genotyping, and this is included in this particular branch known as pharmacogenomics. Now, the very important subdivision or very important branch of pharmacology is pharmacovigilance. What is pharmacovigilance? It is the continuous monitoring of unwanted effects and other safety related aspects of the marketed drugs. The basic core definition is it is a science related to detection, assessment, understanding, and prevention of adverse effects or any other drug related problem. Now I'll tell you what happens. The clinical trials are conducted prior to the drug approval. They cannot uncover every aspect of the drug effect. Many of the drug effects, they are discovered later. So WHO suggests that every country should set up a pharmacovigilance center, and the adverse drug reaction data of any new drug or even the old drugs, it should be shared with the global healthcare community. And how it occurs? It occurs through WHO Uppsala Monitoring Center, that is UMC, which is located in Sweden. So that is the whole process of pharmacovigilance in very, very short. Now, these two are the alien fields of pharmacology, not much in use, but we ought to know them. The first one is pharmacognosy, which is the study of sources and identification of drugs from various sources like plants, minerals, and animals, etc. And the second one is biopharmaceutics. It is the study of effects of drug formulation on the therapeutic response. With this, we finish with the subdivisions of pharmacology. Now we have studied so many subdivisions, so many branches of pharmacology. Is there any relation among these branches? Let's get to know. Now this is a beautiful diagram which depicts the relationship between few of the main branches of pharmacology. Now this shows the relationship between pharmaceutics, kinetics, and dynamics. First of all, the disintegration of the drug occurs and bioavailability occurs. This is the concept of pharmaceutics. Pharmaceutics give an idea of the dosage requirement. Next step is the absorption, distribution, metabolism, excretion. I hope you all remember. That is pharmacokinetics. Pharmacokinetics helps us to find the concentration of the drug in plasma. The next occurs the drug receptor interaction, and that is a part of pharmacodynamics. So pharmacodynamics tells us about the concentration at the site of the action. And then occurs pharmacotherapeutics, which leads to drug effect or the response finally. So you see how these branches, pharmaceutics, pharmacokinetics, pharmacodynamics and pharmacotherapeutics are the main ones and they are interrelated and finally leads to the drug response or the drug effect. Isn't this wonderful? With the knowledge of the interrelation of the various branches of pharmacology, we are going to end our topic, the basic definitions of the various branches or subdivisions of pharmacology, including the main ones and the allied branches also. So, that's all for today. I hope you all liked the topic. For my podcast, you can visit at ispharmacologydifficult.com and I'll be coming up with more of such informative videos about different topics of pharmacology. Thank you.